We're going to be checking in with Colorado Springs Orthopaedic Group. Let's take a look.
Hello everyone, another Medical Minute this morning, and we are out at Colorado Springs Orthopaedic Group. This is Dr. Jeffry Watson, orthopedic hand physician. How are you, doctor?
Fine, how are you today?
I'm well. Okay, let's talk about the difference between cubital tunnel syndrome and carpal tunnel syndrome.
Carpal tunnel syndrome, they're both nerve compression problems, all right? And it's not an outside object pressing on a nerve, it's your own anatomy most of the time. And in carpal tunnel syndrome, the nerve gets pressure on it by the tendons, a little swelling that's alongside the nerve, and it pushes it against a strap or a ligament that we all have here. Cubital tunnel syndrome is the difference is that it's up here. And the cubital means elbow, and it's a different nerve. It's the ulnar nerve, and it's your funny bone. You've hit your funny bone since you were a kid. Oh. It's not a bone. It's your ulnar nerve is what you're hitting right here. And we all know what that feels like.
Yes.
It gives you that awful zinging that goes to that corner of your hand along your pinky side. That's where the ulnar nerve goes. It gives us feeling right there. And so the ulnar nerve, just like the median nerve at the carpal tunnel, the ulnar nerve can get pressure on it as well and give you symptoms of numbness and tingling that go on this side of your hand. It can be achy, and it can also make you feel kind of weak with grip and fumbly.
Okay.
Similar to carpal tunnel syndrome, but it classically involves your pinky and part of your ring finger.
Okay, so those are the symptoms people will feel when they're dealing with cubital tunnel syndrome.
Largely, yeah.
Okay, well, let's talk about treatment options for somebody who's going through that.
So most of the time when people have this problem, it's not something they've done, they haven't sustained impact to it, it'll just start happening. And so for a lot of us, just like carpal tunnel syndrome, when we tend to sleep like this, guess what? We sleep with our elbow flexed at night. So a lot of times we'll have people wear a night splint. You can even make a homemade one that blocks you from flexing your elbow when you're asleep, because if you don't have cubital tunnel syndrome, you wake up like this, no big deal. These people wake up in their hands like this in the middle of the night or in the morning when they wake up. So we try to take pressure off the nerve when they sleep, is what we usually do. It's hard to not bend your elbow during the day because it's not practical. We got stuff to do. So nobody can wear a splint during the day and get anything done. All right,
exactly.
So that's largely what we try to do for folks when they present with those symptoms. Yeah.
Now, this is something fairly common, as you were saying earlier with me today. What happens if they don't get it treated?
So if a nerve is under enough pressure for a long enough period of time, it can undergo scarring on the inside of the nerve, and where people can have long-term numbness, or even more problematic, there's a group of muscles in our hand that nerve controls where they start becoming weak. And if we do get the pressure off that nerve surgically, if it's been too long, that may not come back. And I'm not trying to scare everybody, just go get checked out for this, because sometimes this goes away. And we don't operate on everybody who has this problem. It often gets better. So we try these measures, but if people start getting these other features where they're numb, staying numb, or getting any muscle changes, then we talk to them about doing a surgery to take the pressure off that nerve. And what that usually entails is an incision on the back side of your elbow right here, and unroofing that nerve. There's a strap that goes over it, and potentially also very commonly done, moving the nerve from the back to the front to take the external compression off the nerve and also to take the tension off the nerve. Anything that gets better local blood flow to the nerve so it doesn't act up like that.
Okay, now would that be a cubital tunnel release?
It's called an ulnar nerve decompression or transposition.
Okay.
You're right, that's what it is. But the terminology that's used is usually just ulnar nerve decompression or transposition.
Got it. And when a patient has to undergo that, what is the recovery time like?
So if you just get your ulnar nerve decompressed, you're usually not immobilized. Both of them, it's usually a soft dressing, meaning not a cast, and your hand is free. But we like to slow you down for about a month after that operation as far as vigorous pushing, pulling, throwing, playing golf, rope climbing. We wouldn't want that, but still usually you can do your household things, get dressed, cook some breakfast. You can do those things, but no doubt you're sore, a little gimpy just because you're sore for a bit. Yeah.
Got it. Well, thank you so much. Great information this morning.
Yeah.
If you feel you may have cubital tunnel syndrome, don't let it go untreated. Come see the doctors at Colorado Springs Orthopaedic Group. One way to get more info, go online to csog.net.
And if you would like to get some more information, don't forget you can just go and check them out online. And again, this segment's been sponsored by Colorado Springs Orthopaedic Group.